Can BPC-157 be used for chronic pain management? Now, for those of you who are in chronic pain, I feel you, because it's something that's like, it just slowly leaks out your energy, your life force, and it's hard to show up in life. And so in this important video, I'll be talking about some of the research that's been done for pain management, but also some of the good news out there for those of you who are suffering. So I promise to go deep into this video. I promise to share references. And for those of you who want to actually explore the use of pharmaceutical grade BPC-157 from prescribing providers, I'll give you the option to do that. So let's jump in. So if you look at chronic pain, there's roughly 11% of Americans that have chronic pain, and that's more people who struggle with chronic pain than who suffer from diabetes and cancer and heart disease. But it's not talked about very frequently because what most doctors do and what we've done in our society is we think, let's mask the pain. And we've seen what's happened with Purdue Pharmacy, where the Sackler brothers, they created an epic empire, billions and billions of dollars. The Sackler brothers actually utilized it by exploiting the Americans who had chronic pain. And this is where OxyContin came out, and it was considered non-habit forming, but we all know the end of that story, and that is an empire where many medical establishments have taken down. Now these institutions, these medical institutions where they donated to, they said, we don't want to have anything to do with you because they found that they rigged the system. They had fraudulent claims around the addictive nature of these drugs. And so here's BPC-157. And BPC-157, it's called the body protective complex. It was discovered at a university in Croatia. And what they discovered is that every cell in your body has receptors for this molecule. It's naturally made by your gastric secretions. And its mechanism of action, the thing that this does in your body naturally, can help mitigate pain in very unique ways. In fact, there's one study, it was published in the Journal of Orthopedic Research, and they demonstrated that BPC-157 significantly improved the Achilles tendon of this rat, and they exhibited enhanced biochemical property, greater tensile strength, and elasticity. And, with all that, they found that it promoted tendon repair and joint health. And those are all the things that can lead to chronic pain. And what's interesting about this is they looked at this, not just soft tissue healing, but tendon healing, ligament healing. They found that by activating what's called angiogenesis, or the formation of new blood vessels, and then turning on the cell signaling, it's a way that you can downregulate the pain response in the body. BPC-157 also works on creating neuroplasticity in the brain. Now, here's an interesting piece of research. When I was in school, we found this study where they took 300 participants. Half of them had chronic back pain, the other half had no pain. And they did MRIs on every single person. And at the end of the day, they looked at the results of the MRI. And in the group that had chronic back pain, 50% of them had diagnosable conditions in their back. Maybe they had spinal stenosis, herniated discs, degenerative disc disease. They had a diagnosable condition. The other 50% in the group with chronic back pain, there was nothing diagnosable. Their MRI looked perfect. Now you take the group that had no pain at all, no back pain, and what they found is 50% of them had diagnosable conditions in their spine, degenerative disc disease, disc herniations, facet joint injuries, they had degenerative disc issues. And then the other 50% had nothing wrong with their back. So pain is complicated because where does it come from? And one of my patients who had his arm blown off by a PED in Afghanistan, and he came in for acupuncture treatments for carpal tunnel syndrome. And I was like, this is crazy. He's like, I don't even have a wrist, but yet I have all this pain in my wrist and my hand, and it keeps me up at night. So we start looking at pain, and we find that it does two things that are very damaging for your future. Number one is your brain ages faster. Just by having chronic low back pain, your brain, from a functional MRI perspective, will age at least 7 years faster than somebody who doesn't have chronic low back pain. The other thing that they looked at is people who have chronic pain also have more mental illness. And rightfully so, because you don't feel good. And if you're in a lot of pain, it makes it really hard to push through your day. There's a really good book, I think it's a great book, by Christina Norge. It's called The Balanced Brain. And what she established is she said, just the pursuit of pleasure in life can actually make you happier, and it can be a way of mitigating pain. She is someone who is also a chronic pain sufferer, but she'd never tried BPC-157. So if you see this video, or if you know her, make sure you send this video to her and say, hey, we need to try BPC-157. She had like a foot issue that was pretty severe and even led to some depression. So the thing about BPC-157 and the problem with the medical establishment's treatment of pain is they've treated it by suppressing pathways. And what we found in our practice is if you can accelerate the body's ability to heal and you can downregulate some of the pain processes in the brain, you have a great chance of overcoming chronic pain. One of the things that you'll find is in your neurons, in your brain, you have these beautiful neurons and trillions of neurons, but they're protected by glial cells. And these glial cells are like, there's roughly 8 or 9 glial cells per neuron. And they're the ones that detox the brain. They're the ones that make sure that these dendrites are forming properly, you're getting the right synapses, and you've got the right expression of neurotransmitters. But when you have chronic pain, these microglial cells, they start to vibrate abnormally. And then you have this mitochondrial imbalance in the brain. And then you have this, when there's this mitochondrial balance, it creates this energy crisis. And that energy crisis is what keeps that pain signal going. And then it's really hard for you to see a better future for yourself. So using a peptide called SS31, what that does is it calms down the microglial cells and it gets the mitochondria producing energy in the cell. You can also use methylene blue, and that activates that pathway to feed the energy in the brain cells. And then one of the beautiful things you can do is add in BPC-157. And what BPC-157 does is it creates more BDNF, or brain-derived neurotrophic factor. And with BDNF, your brain gets plastic and it starts to heal and it starts to get different signaling. And then you add in like IGF-1, LR3, which is a phenomenal peptide that unlocks more of the gene that expresses IGF-1. And it's a really good place to start when you're down-regulating chronic pain. The chronic pain is not from the knee, it's not from the back. Typically, it's from the response of the brain, and that's what we've learned. And there's a consciousness to it because pain is resistance. So we have to ask ourselves with chronic pain, what am I resisting in my life? What future am I not willing to move towards that my soul is calling me to move towards? And what I find with BPC-157 is not only is it a safe and effective treatment, but it can also heal the brain. It activates muscles, it activates angiogenesis, so it's really good for our heart. And it can help you feel more athletic. So you want to move your body more because movement is healing. And when you have chronic pain, you move less. And ironically, you need to move even more, but move in the right way. And so you can go to agelessfuture.com. I've got a great team that can help you figure out the best pain strategies. One of the things that we found is just by using intranasal stem cells. This is just a novel technique of using a device called a sphenocath, and that calms down that inflammatory response in your brain, and it can make a huge difference as far as the way that you feel. And then treating the areas with some type of regenerative medicine, and BPC can be a great advantage for you in overcoming the chronic pain. So you don't have to suffer with it, and you don't need to take all the drugs that suppress your body's own systems and feedback loop. And then the final thing is if you've had a lot of steroidal injections, maybe you've had cortisone injections in your shoulders, your knees, your back, wherever you've had the chronic pain, overuse of these steroids can be very dangerous and they can cause an increase of pain in the long run. That's why most doctors will only do a certain series of these injections and then they'll stop. But if you have had an overuse of these, BPC-157 has been proven to help mitigate the damage from these cortisone or steroidal injections. So if you love this video and if you're like, wow, I really want to get some help, I want to learn more, then all you need to do is go to my next video and figure out what is the best BPC-157 on the market. And I'll share with you my knowledge in that. And I'm Regan Archibald, and I'll see you there.